and I am a researcher at the Brookdale Institute.
Hi, I'm Nadav. I'm a researcher at the healthcare team at Brookdale Institute.
I'm talking to you from Berlin, where I have been living for the past 10 months to finish my joint PhD between Ben Gurion University and the Technological University of Berlin. When the pandemic just started, policymakers from all countries were desperately searching for ideas and examples of policy responses to such a new, unexpected and threatening crisis. This was even more necessary within the healthcare system, as policymakers didn't know how much equipment there was necessary to meet the pandemic needs. So, for example, how many ICU bed units would be needed? How many masks should they be buying?
Who's being tested? How many people are being tested daily? Where are they being tested?
Another concern was that countries were making super fast decisions in a situation of great uncertainty.
The problem was there was too much information lying around, and was problem getting the correct data and the relevant data.
Ministries were reaching each other, but there was no platform that pulled all the information together. In early March, the Israeli Ministry of Health approached me asking detailed information about Germany because I am living in Berlin. When I saw COVID-19 spreading outside China and reaching Israel and Europe in early March, I got really stressed. First of all, because I understood that this would be a game changer. Quickly, that became my top priority. It was clear that this was one of the biggest global crises the healthcare systems would ever face. As a researcher specialized in healthcare systems and health policy, I couldn't just stand still.
The European Observatory is a subsidiary of the WHO, of the World Health Organization. They started this project of collecting data from different countries about what they do in accordance with the pandemic.
The observatory team put together a set of standardized questions, so the information could be collected in a comparable manner. How are they reorganizing hospitals? How are countries paying for their health professionals?
What kind of procedures still happen in other hospitals around the world? What kind of surgery is still happening during this virus? Brookdale is the representative of Israel, so we are the body, and Ruth is our representative.
We were in charge to describe Israel's responses to the pandemics and how it attempted to contain the spread of the virus. We were in touch with the Ministry of Health to get this information. We also collected this information from the media and from the press.
As researchers, we know how to look for things. We know how to make it accessible afterwards, to write it in a clear way.
We gathered all the necessary information and we wrote it in a language that would be easy for policymakers to understand.
After that, we published the document online, and it was easy to compare to other countries as well in this platform.
And we put the Israeli context in a way that people from outside would understand what's going on in our country.
Since then, we've been updating constantly about new regulations and testing capacities and who gets a test, so everything concerning the coronavirus on a public policy aspect. For now, we know that several countries or officials from different countries contacted Ruth for more information.
For example, the president of the European Public Health Association asked me about the application Hamagen that does the digital tracing of infected individuals. I provided information and bridged between the president of the European Public Association and the responsible person at the Ministry of Health, and they were in touch later to see how they could adapt this app to other European countries.
Working during this time was obviously different. Ruth is based in Berlin, in Germany, so we had to do this long distance. Ruth was really on top of things. Like, she was non-stop working.
I started working very early in the morning before the kids woke up, and I kept working at night after they went to bed. I didn't take weekends, I didn't take holidays. I had to take care of the kids, homeschool them, I'm still homeschooling them, entertain the little one, and somehow be in touch with my mother, who made Aliyah from Brazil 1 month before the pandemic started.
Usually we're alienated from our research subjects, so we research something that does not have anything to do with what we experience in our daily lives. I think the pandemic, what was different, that studying something that has a direct impact on our lives. I'm writing things that are right for me as well. So in that instance, it was odd. I would sum up the latest instructions from the Ministry of Health and then, try to figure out what it means for me. Because, if you have to put a mask in public, then Nadav also has to wear a mask. Friends would ask me, to help them understand the new regulations and everything, and I would struggle because sometimes it was really hard to understand what you're really supposed to do at this moment in time.
It was not so easy to understand what was going on in Berlin. I had to read news from both countries, from Germany to know how to behave, and from Israel to know what was going on and report to the European Observatory.
This was a really important project and really interesting project.
I'm happy, obviously, and proud to be able to do my part and contribute in the fight against COVID-19 pandemic, because it provided timely information from reliable sources translated into policy language that helped policymakers shape better responses for the COVID-19. We did our part representing Israel, and other countries benefited from it. But Israel also benefited because other countries also gathered the data and presented it in the platform.
I hope that the long-term effect of this project would be that Israel and a lot of other countries as well would study what they did, what other countries did, and then have a more robust system in the future. On a different note, the research itself, I think it would be useful for other researchers in the future. So obviously we'll see a lot of papers, scientific papers coming out on this event. A lot of it will be related to public policy, I'm assuming. And what the database we created would be a really useful tool for a lot of these researchers.
This was a beautiful collaboration and a nice example of how cross-country research benefits policymakers of our countries.
What Brooke Doe did was put the information in a credible site owned by the WHO. That way, when you're a policymaker, this would be the first place you'd go to.